this.
Are you doing that?
And here we go. Oh.
Paul. What are you doing, Paul? All right. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That's a quote by Dr. Martin Luther King Jr. that I feel like, whether that's part of your motto or not, definitely embodies what your organization stands for, trying to do. But today we have a special guest, Brianna Grow, with the Community Health Clinic. But before we get started, I'm Adrianne Cornejo.
I'm Casey Kearfott.
Oh, and we are here with Brianna Grow. She's with the Community Health Clinic. That is, we've talked about how we've changed up our Giving Back program. And so this month, the month of May, all of our closings will be going to the Community Healthcare Clinic. Or
A portion of our
Yeah,
closings.
a portion. Sorry
Don't
about
get a little
that.
carried away.
Sorry. A portion goes to them. And we're going to ask her some questions later on. She's going to tell us all about what the Community Health Clinic does and how it makes our community a great place to live.
Yeah. All right. So before we dive into that, we're going to have some red wine today because with healthcare being the focus, not that drinking is necessarily good.
You know,
Red wine, there's a lot of studies, right, that show that red wine has some health benefits. So
Absolutely.
I think that that's a corker.
yeah, well, you got to cut the foil.
Listen, I don't drink wine.
I know you
I
don't.
just buy it.
All right. We got to use the office scissors here.
I don't even know why you have me buy wine when I don't even drink it.
That's a great service that you do.
Yeah,
It
I have
is.
no idea what it tastes like.
No, the last time we had red,
It
you
was
didn't like
okay.
it.
I didn't mind it. It wasn't my
What
favorite.
kind is this?
A blend.
See, you might like it, all right. We'll see.
We'll see.
Casey grabbed an Apothic Red Winemaker Splend. So we went with red wine.
$10.99 a bottle at Target.
Target.
I know where I went, but I'm just saying in case I went to the gas station. But in case you want to know, you can get it at Target for $10.99.
Get it at Huck's on the corner.
Yeah, but it's $12.99 at the Huck's.
So anyway, we're gonna do red wine because it's rich in antioxidants, helps keep your heart healthy, regulates blood sugar, and helps reduce the risk of cancer. And one of the things in red wine, they say, actually helps to keep your memory sharp. It helps with people with Alzheimer's. One of the ingredients in red wine, don't ask me which one because I didn't write it down. It actually enhances something that goes bad with Alzheimer's.
That's
So,
amazing.
yeah, so excessive drinking of alcohol is not good. There's a number of bad effects on your health there. So I'm not saying,
We're not saying
overly drink, but, and it can be life-threatening, right? You can get psoriasis and all sorts of stuff from overly drinking. Here you go, Paul.
Thank you.
But having a glass or two of red wine a day can be beneficial. Always check with your doctor,
Yes.
everybody's
Medical
conditions,
professionals.
a medical professional, because your specific conditions or medications you're on or something.
I feel like we need a disclaimer at the beginning.
I know, right?
So.
Cheers.
Cheers.
And we already have a few
Cheers, my
messages, a few comments.
What's
Oh,
Beth says, I like that. I assume she's talking about the wine.
Probably. She drinks a lot.
Caitlin says, Lauren says, hi, Mommy.
You gotta figure.
And Deanne Ambrose says, hi, ladies.
Hello,
Hi.
Deanne.
So if you're not a big wine drinker, you can use it in cooking and stuff too, and still get some of that stuff. And that actually, if you're like putting it in a sauce or something where you heat it up, it burns off the alcohol. So some of the negative benefits would be reduced if you want to cook with it or something.
That's how I enjoy my wine the most.
Is
with
it?
Risotto.
Oh, it's great in a risotto.
yeah.
I use it in every time I make tomato sauce,
Really?
Sure.
any sort of Italian red sauce at all, pretty much, and throw some in, except for vodka sauce, then it's vodka, but
Exactly.
That's the kind of sauce I like.
So red wine also has studies that show it can reduce headaches, your calorie intake compared to maybe some other alcohols and things like that. Anyway,
Who knew?
who knew? You want to talk about our contest this
The
month?
more you know. Yeah, okay, so this month's contest is we're gonna be posting pictures of us holding up little signs with trivia questions about kind of just certain things that we did last year in our
Well, like this
business.
week
This week was how many videos did we do last year? Like for the whole year, how many videos?
And the answer was revealed today.
Yeah, it was 112.
112. So next week we'll post new trivia.
Yep.
And
Look for that.
Tuesdays. On Tuesdays we're gonna
Tuesdays to Thursdays.
Yep.
And then you get to win at the end of the month, Hannah with American Home Shield will be with us, and she is providing us like this cute little cutting board. I think we have it.
She sent it already actually.
And it's got dried
This
fruit.
was not planned.
So
it's
it would
just
be
happened to
great,
there.
like if you wanted to kick off the
From
summer.
a place called Oh Nuts.
Yeah, with like a fun, you could do like a fun charcuterie board with the dried fruit,
So,
That's beautiful.
right?
see? And it's got an apple-shaped board. Apple a day makes it so you don't have to go see the community health clinic.
So anyways, that's what's going, that's what our trivia is this month. So we hope you guys have fun with it. We know we had fun pulling our numbers. That was fun. But
All right,
should we get to our questions?
let's do it.
Okay,
Let's do this.
I feel pressured. I'm kidding.
No. All right. So you're currently the the development coordinator at the community health clinic, correct?
That's correct.
So
Yes.
what is that? What do you do there?
Well, there are a lot of things that fall under that title. Primarily is fundraiser. So I'm writing grants, running fundraising campaigns. Normally, I would also be doing events. Sadly, I haven't gotten to do that in over a year. I'm very sad about that, but we have been doing virtual events instead. So just like you guys, doing live videos, putting ourselves out there on the web more. So I also handle our external communications. So if you're seeing things on social media, I have put it there. That's the reason that we have had a lot more puns on our social media since probably about 3
no.
years ago.
Love a
You
good
two,
pun.
you two
Love
would
a good pun.
Mm-hmm.
have lots of puns if you got together. Casey loves a bad joke and a good pun.
Yes.
Right?
Yeah,
See, I'm not the only one. We should have put a bad joke in here
we
today.
should have. And
I'm
we
sure we
we
could have
went
found
that
lots.
so many times too, and puns. We didn't. We went with Martin Luther King Jr. quote.
That's
Sorry.
okay.
We're right for the heart.
Yeah. So, how long have you been with the community health clinic?
Well, actually, my time with the community healthcare clinic started as an intern. So I was a senior at ISU, and Angie, the director at the time, was looking for someone to help out with their social media and kind of the things that, you know, busy directors just don't have time to manage. So I came on as an intern, and that was back in 2015. So
You never left.
I went off and did
Oh.
a couple things for a few
Okay,
years,
maybe
but always
not,
stayed
sorry.
in touch. Oh yeah, no, I would always check in with Mike and Angie because they're such fun people. So
Yes.
I got hired on as a Vista in 2018 and then officially a staff member in 2019.
Oh, so fun.
So, what drew you to the organization? So, obviously, it was an internship. So, when you're in
Yes.
school, you're just looking for something to gain experience. But,
Yeah, right.
But obviously, you went back, so you
Yes.
like it. Something there is. So, what drew you to the organization?
Well, honestly, the first thing that drew me to the organization was the people. When the people you work with are passionate about what they do, it makes it an incredible place to be. And the people at the clinic cared so much about the patients and were working so hard to do everything in their power to get them healthier. You know, Mike says, whether you like it or not, you're going to get better here. So that made it a really inspiring place to be. And they also were just so willing to teach me things, to get involved. So always learning and finding new ways to connect with folks. So
That's awesome.
a lovely place to be.
So, what services? So, let's backtrack a little.
Yeah, sure.
What services do you guys offer? Like, what is the community health clinic?
Yeah, so the community healthcare clinic is a medical and now dental as of 2019.
That's a
Clinic-
very big need.
Yes. Yes, yeah, and took several years to get that up and working to address that need, but we're finally doing it. So we're a clinic for people who don't have insurance. So there are different ways that you can end up with that. One is you don't have a job. One other one might be that you work several part-time jobs where you're not offered insurance. Another one is what we call underinsured. So that's when you're offered insurance but you can't afford to use it. So we've all seen those plans that have really low premiums, maybe even as low as 30 cents. But then you have really high deductibles that nobody is going to consume that much health care. So then you're kind of living in the gap where if you get sick, you aren't going to meet that deductible to actually have your coverage.
So you're basically still paying out of pocket.
You're still effectively uninsured.
Yeah.
And cash pay pays the most for healthcare. So if you don't have insurance, your bills are going to be way higher, and that's going to keep you at home or going to the emergency room instead of getting the preventative care that keeps you from getting really sick.
Speaking of emergency room, we have a medical themed joke from Beth.
Oh boy, let's hear it.
What do you call a ghost with a broken leg?
I don't know.
Ghost with a broken leg.
Mhm.
Tell us, Paul.
Hoblin' goblin.
Oh, that's a good one.
Do ghosts have legs?
No, you should use that one for Halloween.
Ghosts usually, well,
We
some
should
do.
tell
I guess. I mean,
Depends on the
bad
ghost.
medical jokes.
I
Yeah,
guess,
there
you
you
know,
go.
the ghosts in like
Should have a
Beetlejuice.
series.
I mean, they're just people.
Yeah,
Yeah.
depends on the ghost.
Okay. Depends on how they're depicted, right?
Right.
All right.
Good one, Beth.
So, and I know, like, kind of on that same topic, when I used to do medical massage and we billed,
Yeah.
for example, like you were talking about, so they overbill for insurance because they only get a certain portion. And so, yeah, when somebody's a cash payer, basically they're billed the full amount, even though the healthcare company only pays about a third of that.
Yes, there's no negotiating power
No,
when you are showing up cash pay.
yeah, with no insurance. So it does make it very tough. Who founded the organization? How long has it been here? Or?
Yeah, this is really easy for me to remember because the clinic is as old as I am.
Oh.
So, yeah, 26 years old.
Okay.
Incorporated in 1993, officially saw the first patient in 1994. And it was founded by a group of people, really.
Okay.
So we had medical professionals, people in the faith community, who saw this need at the local hospitals where people were coming to the emergency room who didn't have a primary care provider and they didn't have insurance. So they keep coming back to the ER because they have these unmanaged chronic conditions. So this community of folks at the hospitals and local doctors said, we need to do something about that. You know, these are people who aren't getting the care that they need. They were willing to volunteer and show up to provide care for these folks. So they had a meeting at the Bloomington library and just hammered it all out. Became a nonprofit and started seeing folks. And it started as a completely volunteer run clinic. So there were no staff members. They were doing this, I think, on a Wednesday.
Just
getting
like a one day a
people in.
week, like we're just gonna knock
started
it all out.
Really small. Yep.
It's cool. And now it's grown.
It's grown.
Now you have a building.
So much. We have a building. We have a big building now.
Oh, is it my turn?
You're,
Oh no.
I was
Where
trying
do
to
I
let
come?
you nonchalant, but
This is
Oh,
the year we
okay, so
started high
where
school.
what, 93?
93.
Thanks for that, Paul.
I always love throwing out that fact just to see where everything
I
lands.
was two. So
You were
Thanks
what?
for
I
that.
was two.
You were
Appreciate
two?
it.
I was starting high school. Thanks
So
for the math,
Look
Paul.
at this, you guys. Okay, so where does most
You were
where
starting
does
high
the-
school too.
Yeah. Where does the funding come from?
Yeah, so we have a couple different funding sources. One is, of course, donors. So individuals who are willing to support the clinic, whether it's with monthly gifts, one-time checks. We also get support from grants. So that can be national grants, local grants. The John M. Scott Healthcare Commission is a local trust that provides a good amount of our support. And then also corporate donors. So folks like State Farm, who provide grants and then also matching giving programs.
So an employee there gives and then they match the donation.
Exactly, yes. And there are several employers in Bloomington Normal that do offer that. Country Financial, I believe, is another one. So
All right.
Very
always
cool.
good to check.
Yeah. And then, I mean, how much does it cost a year to run the clinic, or like a day? Is it a lot? For sure.
Do you know like an average?
A day, I don't know. You know, our payroll checks. So I do know that one cycle of payroll is about $50,000 for the clinic, and that's our
So every
largest
2 weeks?
expense. Well, monthly.
Okay,
That's once a month. It's a little better. Yeah.
a little bit. But you have a lot of moving parts.
Yeah, there's.
We do, yeah, and people are our biggest expense because we have amazing partnerships with our hospitals, so OSF St. Joseph and Carl Broman Medical Center, that allow us to, for example, rent our building. So we're not responsible for the maintenance. That's
And do
incredible.
they give you low rent? You know?
Yes, they do. Yeah. They also take care of things like our IT and our HR. So things that would be a real headache and additional expense for us to manage.
And liability.
And liability. Yeah. And being a free clinic, we're also covered under something called the Good Sam Act. So volunteers are free to come in and not worry about that. Medical professionals can just practice medicine.
Very cool. How has working at the community health clinic brought you like closer to the community, or made you connect to the community more?
Oh, well, part of the neat thing about working at the clinic is we have sort of an invisible part of the community in the people who work in the service sector. So, you know, from being a student to going on to work in, you know, an office setting, there are folks that you don't really come into contact with, but at the clinic, you know, we're seeing a lot of these folks who maybe you wouldn't talk to somebody who stocks the shelves at your grocery store or is handling like lawn care or painting. But you hear all these amazing stories from people about working to take care of their family or putting their kids through college, really genuine, hardworking people who are in our community and who also don't speak my language. So there are Spanish speakers and French speakers, and being able to interact with them in a setting where you have a translator. So you can learn more about their lives and their families, where they came from, if they're an immigrant. It's just an amazing opportunity to talk to people who you normally wouldn't.
Mm-hmm. Yeah, it's so cool. And then, like everyone, COVID has kind of thrown a weird wrench in things. So how have you guys had to like pivot or make changes during that time? Were you open?
We were. We have not closed throughout the pandemic because our patients' chronic conditions don't stop just because there's COVID. We ended up doing a lot of telehealth. So that's actually
And I feel like even before COVID, a lot of places started pivoting to that. Did you
They
guys
did,
do
yeah.
prior to COVID?
this was the first time that we had done it, and now it's like, why didn't we do it before? Because now it's very easy to, if a patient says, hey, I got caught up in something, I'm running late, I'm not gonna make my appointment, we say, oh, we'll just call you. We'll just do a video chat. So then we're still getting that touch point with the patient. We're not missing out on that valuable information of seeing how they're doing or providing them info on how to do better. And we also had to just rework things with medications because, again, people still need their meds, even if we can't bring 20 people at a time into the building. So we had an exterior window where we just kind of did drive-through style, and that worked out really well.
Very
So.
cool.
Yeah, I feel like a lot of the medical profession is going to a lot of telecare even prior to this.
Totally.
I know my dad, when he was in ICU, the doctors don't come in. It was all tele.
Wow.
I couldn't believe that in ICU, I would have thought.
Yeah.
But it's a big screen and they just communicate with the nurses in there. And that was prior to COVID.
It's definitely not going away.
Yeah, I wouldn't think so.
It's still my turn. I'm just asking, I'm just making sure.
Mm-hmm. How can somebody go about
I
getting
got
involved?
Oh, thank you.
How can someone go about getting involved that wants to either help out in some way or donate, or what are your biggest needs?
Yeah, so our biggest needs are always for translation. patient base is over 70% Spanish speaking. So
You
have
hear
a-
that, Dad? My father-in-law.
I know, he would be great
He would
at
be
it.
fantastic. If you're watching, if you're not, I'm gonna.
Your husband's watching.
Is he? Michael, your dad would be perfect at that. Okay, sorry.
He-
Tell him. All right, go ahead. Sorry. So translation, 70% is Hispanic.
Is
so
Hispanic, Spanish speaking, yes. And then we also do have a growing number of French Congolese folks. So French speakers, immigrants from primarily the Congo in Africa.
Okay.
So I think that we know of, there are about 300 French speaking families
Oh,
in this
wow.
community. Yeah, and we need to be able to talk to them. So if you
Yeah.
speak French, give us a call.
There we go.
Awesome.
How does someone go about like getting help?
Getting help, yeah.
I know.
I know.
So we have great partnerships with our hospitals where someone who's identified to be in need will actually get referred
Okay.
to the clinic. So that's one active way that we find patients who fit our, economic guidelines. So if they're low income, no primary care or insurance. But
So basically, the people like you talked about, they walk into the hospital,
Mm-hmm.
they have something that really needs something different than what they can get at the ER, and then they realize they don't have a way to pay for it, really.
Yeah, so then we have folks at the hospital who will refer them to us. But if you're just have heard of the clinic, think that that is something, a service that would fit you, we have an application process. It's pretty simple, one-page application. We go through that with the patient and then start getting them services. So anybody's welcome to come down during our business hours or give us a call.
All right.
Okay.
So where are you located?
We are a block north of Carl Broman Medical Center, and it's funny describing where we're located now because I can remember when I was an intern, I was late to my interview because I could not find this building.
It is in a weird place.
I have no idea where it's
Yes,
at.
you do. We passed it on our tour
Oh,
last
do?
week.
all
Last
right.
Friday.
Well, tell us where it's at.
It's a little hidden. It's on 900 Franklin Avenue, so you head north from Broman, you're not heading toward Wesleyan, you're heading toward ISU. And then it's tucked away in one of the little historic neighborhoods in Normal, so it's a really pretty spot.
I know which neighborhood.
Yeah. So if we would have just kept going on Franklin instead of me turning on, I forget that road, Glen.
Yeah.
Then
Like a school.
yeah. So it's like literally like a
Yes.
block and a half out from Glen School.
Gotcha.
Glen
On
School is
Franklin.
like in our backyard,
Oh, wow. Okay, yeah, I had no idea that's where you guys were.
hidden away.
Well, and so translators are your biggest need.
Yes.
Without doing the in-person fundraisers, do you have any fundraisers coming up that are virtual that you want to spread the word about? Or
No.
what's the next thing you have coming up as far as like an event or?
Yeah, well, if you already are a donor or supporter, we will be giving you a call in June because we will be running a thank-a-thon. This is the first time we've done this, but we want to make sure and reach out to all our supporters and say, after a crazy year, you managed to continue to support the clinic of all things going on and thank folks. So look out for that in June. As for fundraisers, the next thing we have planned is our, that'll be getting into November when we do our Gift of Health campaign. So that's actually our largest fundraiser, where we reach out to folks and tell them about a patient who we've helped in the past year and ask if they'd be willing to support for the next year's operations. So yeah, we definitely missed the luncheon this year. And
You
normally
always
we'd
go
have
to
a
that,
summer
right?
event.
Yeah. It's
Yeah.
my fave.
I've never been, so as soon as you guys have one again, I'll have to go.
It's really good. It's very inspiring.
Thanks.
Oh yeah. So
We're gonna-
we do a little real estate.
Okay.
We do.
I'm here for it.
So, okay, the market is crazy, like everyone knows. I'm kind of sick of saying it's crazy. It's like, I feel like a broken record, but we have 207 active listings in Bloomington Normal right
I was like,
now.
not us personally.
Yeah, no.
The whole
We have,
area.
there's 422 pending houses, And then there's 190 closed last month. So that's how many closed in the month of April, was 190. Our average list price is $169 and our average sale price is $175.5. So that is like a $6,000 difference from what the list price is to the sold price. So that means that things are going way over asking.
About 8% over.
Yeah.
Roughly.
Yep. So
Over asking price on average.
on average, yeah, give or take. But that's the market in a snapshot. It's crazy. So if you're thinking like, oh, if I got this for my house, I will sell it. Call us because you can probably get that much for your house.
Yeah. Make me move price.
I'm also, and I know we've talked about this before, but I'm looking for a.
Wants and needs. Yeah.
I just have to because I have to find them.
I know you do. I like that's not on here.
I
Go
know,
for it.
but I'm
Go
going
for it.
rogue. I need a house like
We do need the
325
house.
to 350, 4 beds to 5 beds with a finished basement, ideally with a bathroom, or a rough-in 3-car garage, or we'll do it 2.
Has to be unit 5.
Has to be unified. So if you have that and you're like, oh, I have it and I'm gonna sell, call me first. 309-261-7193. Ask for Casey.
So next week we are actually going to be filming our happy hour at the old Oddfellows Lodge in Uptown Normal. We're going to talk about some fun history of that. Maybe take a tour, but it's all updated. Not a lot of the historic stuff is still there, but it's still really cool.
We're trying out this awesome drink machine.
Yes, that's what. Do you know where Maggie Miley's is?
Her maiden last
Same.
name's on the building. Just look for
But
that.
Maggie Miley's is downstairs, and we're gonna go to the loft upstairs. Yeah. So it's been all. You haven't been there at all, have you?
No, I just know it because it says Fuller on the building.
Yeah. Okay. So anyway, we're gonna go there, and we get to. Yeah, I'm really excited about this drink
Me
machine.
too.
So we were told about this contraption that they have like pods, like like a Keurig, but like actually probably more like a
Espresso.
Nespresso.
Same
And
thing. There's different shapes.
if you're a coffee drinker and you've drinking both,
It's different.
they're not the same thing. No
It's
offense to
very
you Keurig fans, but
Okay.
I can't do it.
I can't either. It's gross. Anyway, it's more like an espresso machine, but with alcohol. They have little pods that literally you can make anything under the
Right?
sun. Apparently, they've got Mai Tais and margaritas and daiquiris and literally anything.
We're gonna try a few and we're gonna.
Wow.
And then
We'll-
they
we'll
take.
rate-
This
we'll
is
rate
how
them.
I was told it worked. They sent me a picture. And you dump each of the kinds of alcohol in like these tubes, and then you put the pot in and you start it, and it comes out a perfect mix.
We'll try a few. We'll do a little. I think what we should
So I'm
do.
excited. So we're gonna try out this machine. We're gonna give it our review. We've been told it's 5-star.
We're gonna send it to
We'll
the
be the
company and
judge.
maybe they'll send us a free one.
We're gonna
maybe
be
it'll
the
be my
judge.
first free promotion that I
we
talk
earned.
about McDonald's. I talk about Target. Maybe they'll send us a drink dispenser.
Sponsored by the booze Keurig machine.
It's not made
No.
by Keurig.
No,
or
it has to be an espresso.
No, it's made by, I don't remember. I have to look it up. It's totally
We're
independent
definitely
company.
hashtagging them.
Anyway, we're gonna find some fun history of the building. Maybe
making-
tour,
We're making a swing next month.
and we're making a rope
Yes.
swing like for a tree.
It's DIY week.
DIY week, but we're just going there for the drink machine.
So yeah, but if you would like to donate to the community healthcare clinic, you can send a check. They always will take money.
Yeah,
It's true.
but there's probably, is there an online?
Can you,
There is, yes, you absolutely can do online. Our website is chcchealth.org.
And we-
just click on the donate button.
Yeah, we'll pin it to the top of our Facebook page
For
too,
the month.
for the month. So if you want to donate, it'll be up there.
And or if you want to donate extra from your closing this month from above what we would, or if you're just want to donate some money, you can drop it off here too, but it's probably just as easy to go straight to the website. So
Yep.
Yes, absolutely.
thanks for joining us.
Yeah.
Thank you for
Thanks for
having
taking
me.
Yeah.
time to talk about the health clinic, giving us the inside scoop of over there, and we really appreciate that. We think there's just so many great organizations in this community, which make it just a great place to live.
Absolutely.
So anyway, thanks for watching, everybody. Like us on Facebook, subscribe to our YouTube channel, and thanks for watching.
Bye.
Bye.
Thank you.
And we're out.
How'd we do, Paul?
I'm so happy.
Great.
You're so